And she said, Patty, you keep taking your medication. She said, oh, I will. So what this amounts to is, did you jump on things?
Yeah, the biometric measures.
Okay, they measured total cholesterol. They're a group of five groups. And they measured, for 10 days only, people ate whole plant food diet, which was supplied to them, right, by Nelson and his wife and team. And these folks ate, and they took a blood test before and a blood test afterwards.
Microphone.
They took a blood test before and afterwards, and they measured total cholesterol, LLD, HDL, triglyceride, body weight, and body mass. As I stated earlier, I'll just restate, this is not a rigorous clinical study with group control groups and things of that sort. It's a convenience, a sample of convenience, which means that they were people that were willing to do it. And you might argue that they have what we would call an interventionist effect, interaction with knowing that they're being tested, nonetheless, or placebo, whatever. But the causality is so incredibly powerful, pretty hard to argue with. So the cholesterol, we saw a cholesterol drop of 21% in 10 days, 21%. And that, over 88 were tested, 35 participants started with borderline or high total cholesterol. 77% of those individuals with cholesterol too high dropped back to below 200, to the safe level. Can't argue with that, can you?
No side effect.
No side effects, yeah, that's right, no side effects. And this is total LLD, which is the real tough part of this, the real important part of this analysis. That is to say, the most important measure, not total cholesterol, but LLD, triglycerides. 24.4% drop. Of 50 tested, 20 people cut their risk of coronary heart disease from above to optimal or near optimal levels in 10 days. Triglycerides, again, another critical factor, dropped by almost 40%. Of 33 tested, five recording improvements, with 6 individuals experiencing drop of over 60%. Body weight, 4.5 pounds in 10 days, and or 2.5% of body weight. Okay. And the same measure, only as a body mass index, average reduction of 0.7 units, which is significant in terms of a reduction in risk to heart attack, cancer, and everything else. I personally, after we got off the cruise, I stayed on the vegan diet for the first 30 days, had my cholesterol measured. You'll see later, it went from like almost 240 down to 180. My body weight, I think I dropped about 10 pounds. And you can eat as much as you want. What are the summaries? This is the summary of all the measures.
I want to say something. I hadn't plotted to get him on this cruise so that he would listen to the message. It was pure random. We ended up going on this cruise, and then he got 6 days of brainwashing by doctors with all the data and that stuff, and he came back and said, okay, I'm going to do this. Because we were doing it at home, but he wasn't doing it outside the house.
As I would go out with my buds, Tom and Pat and others, to have lunch, I'd have, as Tom can testify, he's sitting in the back, I'd have a meat sandwich. And then when I'd have coffee, I'd have milk with the coffee, or cream, even better. And of course, you'll hear the rest of my own humbling experience as we go on. So these are the data, 10 days. And I've already gone through them, but I don't need to repeat them, but it's pretty impressive, not a single, and every one of these things were statistically significant to the 0.99 level. And that means not random chance on a bet. These are people that were drawn from the street, essentially. So these are the measures that doctors want to see. So, and there are basically studies that are clinically based that have, this one is an example of people that had documented cardiovascular disease. Dr. Estlin, of 177 people that stuck to the vegan diet, not vegetarian. Coca-Cola is vegetarian, right? Figured. Of those 177, only for 4 years, during that time, let's see, there was only one person that had a recurring stroke. They had already had an event. Only one had the recurring event. Whereas by contrast, 13 people of the 21 who didn't stick with the diet re-experienced a cardiovascular event. Okay? What other potential national health care, and I'm not going to dwell on this, economists take numbers, I'm one of them, and extrapolate to the economy. Essentially what I found is that the American Heart Association established that we lose about almost $190 billion in direct expenditures and $127 billion in lost productivity every year due to cardiovascular disease. And the projection future are going to be even higher. The reductions in LLD, if there was a reduction of 57.9 micrograms per deciliter, it would transfer into about a 1/3 savings of these costs, reduction in cardiovascular disease attack, 1/3 reduction. During the 10-day test, we got half of that. As a result, 15%, that would translate into a 15.9% drop in cardiovascular disease if adopted nationwide. And the results would be a savings of on the order of $205 billion in direct and let's see, 818 billion in total cost by year 2030. Given these potential reductions, Jumpstart Light Whole Planet across the U.S. population at risk could save possibly $73 billion annually of medical costs and $37 billion in indirect productivity losses, people that don't go to work and lose that productivity. And these are, this is a period, end of that discussion. Other research that are relatively important, this was in Science just last week, it said that in fact grain may be the best cure for cancer. It may also be the best cure for people that have had cancer and are in remission, and to keep the cancer from coming back, because it enhances the bugs in your guts and it enhances your immune system to be able to naturally fight off diet, what we're eating. Okay.
Yeah, but it's not GMO grain.
No, it's whole food. Thank you, dear. What are the takeaway points? I hope the takeaway points is we've had our taste buds hijacked by big ag, big processed food manufacturers. The health effects of this hijacking are incalculable in terms of human health, suffering, and economic impact. I, and maybe other people in this room and elsewhere on the planet, am lazy. I am lazy. And can you go back to that? Okay. Thank you very much. And when we don't want to make the changes necessary in our world to change our exercise patterns, our mental stimulation patterns, our diet, and I'm one of these people. I can testify. You may not be, but I am. My wife is not, actually. But fortunately, we still have choices we can make and powerful, long-lasting changes to protect our planet if we stop being lazy. No one's paying me to be here, so I can tell you the truth, can I? Although, Maggie, thank you for opening your doors to us. When John mentioned that people across from him said that they couldn't change their lives, you can argue, I have a sister who's a brilliant mathematician, a master's degree in mathematics, she still smokes, and it's a hard thing to stop. I smoked for 16 years, I know. It's not just lazy, it's also addiction and other kinds of things going on. So, not to put blame on anybody, even myself, it's a process of education and then willfulness, purposeful change. Americans that were asked if they would give up $1,000, this is from the cruise that we took, said no. 24% said no, white Americans. 29 black Americans said no. Less than 10% of Asians and Hispanics said no. So if you're offered $1,000 to change your diet for a week, wouldn't you? A lot of people can't and won't. They can't. That's why John got the answer that you can't change. So during our trip to France, next slide, I found myself a slipping vegan. Sitting at my beautiful mother-in-law's home, I had access to the finest cheese, some incredibly good wine, fine French bread, and sweets. French sweets. And go back. Thank you. And so I indulged, and I milked for my coffee and daily. And my cholesterol went back up as we got back to Tallahassee to 236. So I'm back to high risk, and even the LLD, many of you may not know about this, total cholesterol is almost irrelevant. It's the particle size in your bloodstream that is the risk factor, because it builds up the plaque in your veins. My particle size was going up towards the high end of the risk factor. So you can see here, this is at a vintage where we had captured some wine. We had gone to get wine from a family friend's farm, and this is our natural village fair that we go to, with excellent food all over France. So I'm back to, what do I eat?
It's not that excellent.
Let's see that one again, that's too quick.
Yeah.
So
So wine's not vegan?
Yeah,
wine
it's-
is vegan, but it's loaded with sugar. And sugar, remember the sugar, what sugar does to us?
But what kind of sugar?
Wait 1 second here, I'm almost done. Why?
Me, that's.
and Tim thought it was okay to indulge in cheese because he said, hey, I'm not doing meat, so I'm okay. It's a normal thing, right? Your numbers are good, so you test the boundary. And so every time I put the cheese platter on the table, he would kindly eat cheese with her.
But even in
A lot
France,
of cheese.
even in France, I had choices. My mother-in-law has a wonderful garden, and I'd go out and pick the vegetables every year and every day and make a wonderful salad. We did eat well, but I, on occasion, would go off, and it would more than once a day. Next slide. And here back in Tallahassee, this is my bride giving a tour to master gardeners and others, and Penny Gilmer's here. Yeah, and she's been part of our tours from time to time. And we have a huge, incredible garden, Regine's garden, which, go to the next one. And this is a good view of our garden from right side, back left side. And we have a lovely view thanks to our neighbors in the back that own these wonderfully large homes that give us plenty of visibility and plenty of sunshine. So we eat wonderfully, and that's how we as vegans here in Tallahassee can live, because we have fruit, we have vegetables year round. Next slide. So our garden in Tallahassee, I better get back to work again. This is the get off the lazy training. Next one. So now genetics, and this will be brief. In World War II, the Germans set off a blockade to half of the Dutch population, starved them out. The Dutch were under their control. The Americans and Russians were coming in from both sides, or Americans and allies, and so they created a condition for 9 months where the Dutch was starving. And that is a picture of this little child, and as a result, 20,000 people died of starvation. This is a little known example. The Dutch keep excellent records of birth, death, health along the way, and so forth. And as time went on, scientists thought they would study the women that were pregnant during this period to see what the effects of this starvation were on the fetus. And I'm going to tell you in a short few sentences. If the woman was pregnant in the last third part of her pregnancy, when the fetus isn't growing very much, and the starvation ended on, the blockade ended on at the end of the third month, she was then able to get good nourishment, and the baby grew normally and nothing bad happened. If she was in the first 6 months of her pregnancy, during that period, 6 months of pregnancy, the child's biology was saying, shut down the metabolism, shut down the metabolism. The fetus is going to die unless we shut down the normal growth. And so as a result, there's a thing called methylation, which is one carbon atom and 3 hydrogen atoms that goes into the DNA, like this piano here. It plays a different tune. The DNA is the piano. The tune is the epigenetic code that changes with our environment. So as a result, these children grew up malnourished, and next slide. Those that were in the womb the longest time exposed to the famine developed high levels of schizophrenia, obesity, antisocial personality disorders, obesity and diabetes, heart disease, cancer, stunted physical size, and premature death. Worse yet, this is the take-home message, they passed it on to each subsequent generation. Not just the next generation, but the generation after that. and the generation after that. There have now been 6 generations since the end of World War II. I'm 71, and so I was born just after World War II. And this was my cohort that I'm looking at, and subsequent generations thereafter. And these children of the children are suffering the same conditions. Next slide. And it's not just what the mothers did in their nourishment in the womb. It's what us guys do daily. Tests thus far with rats and mice have proven that dads that eat a high-fat, high-sugar concentration of food wind up giving offspring, and they have liver disease in their liver because of birth, because of what they eat. Pass that on to their children, and they pass that the siblings. This is all the research. I've got it referenced on the bottom. You can't see it, but this is women and men. So what the adage is, not what we eat is who we are, but it's what our grandparents and our parents ate, as well as what we eat is who we are. You are what your grandparents and your parents ate. Next. So, go to the next one.
The mouse.
The mouse, the differences in the mouse, that's due to their
Happy Meal.
yeah,
Happy
metabolism.
meal, happy
Thanks. Go to the
mouse
next
meal.
one. Okay, and then the last thing I'm going to talk about, which is, guess what? There's not a cure for Alzheimer's, but there is hope on the horizon. This was in Scientific America two months ago, and I brought the article.
Never mind.
It's right here. I'm going to hand it out. Someone can pass it around just looking at it if you want to look at it. Guess what the solution, the best solution for Alzheimer's is? Almost 1,200 Finns were tested. They were all people that were in the senior age group, 59 and older, and they've been followed for a number of years now, and they found that the people that had this intervention, this was the intervention. Eating well, not vegan, but Mediterranean diet. They added fish. Mentally active, and a mixture of nutritional guidance and education. The results were an 83% higher improvement over control groups in executive function. That's how we think, right? 150% better scores in speed of processing, time for mental tasks, mental arithmetic. 40% higher increase in complex memory tasks, remembering a series of things because of what they ate, because of getting proper exercise, and because of getting training on social interaction and engagement in their community. I told Tom, one of the research pieces that a friend sent me suggested that a wife, if you have cancer, a wife is worth more than chemotherapy in terms of recovery and recuperation. Social communication, social community. Those are the treatment groups. Also had slower aging genes. Their telomeres, which is the tip of the part of our DNA, it gets shortened as we age. Their telomeres were longer than the control group rather than the comparison group.
That's it.
So that's it. That's my presentation, and I hope you've enjoyed it. And anybody who has some questions, I know Mary had a question, and then Sue. Mary?
I just wanted to know, when you went on the diet yourself, did you also not drink anything during that period?
I did drink wine, yes.
So you still were drinking?
Yeah.
Okay. Have you ever tried it going off alcohol as well?
I am.
What?
Well, I told Regina, I'm working, I'm
Was
trying.
there any difference?
The moment that I'm working on now is trying to reduce my alcohol consumption to almost zero, except for gatherings and parties and things, and because of the sugar load. And I haven't got the results, but after January, I hope to be able to report back
I'd
that my
like to see
cholesterol
the
is.
difference on this. Yes.
Your point about what Dr. Ness said when he's facing his patients and he explains this to them and they say they can't.
Microphone, give me the microphone.
I know, I'm going to unwind it first. Can I unwind it?
I was interested in what you said about Dr. Ness talking to his patients when they say they can't, they're incapable of changing. I think that's the crux of the matter. Is anyone addressing that?
I just said we're lazy inherently as species, and I don't know what else to do. What education, I think, is the key. Education is, how did
He's educating them, they know, and they say they can't.
my sister is still smoking? And she knew.
That word is not I can't, but I won't.
Right, exactly.
Right.
Can't means won't.
Yeah.
Yeah, but what's the solution? How do we get these
That I
people
don't
to
know.
change?
I'm only on step one. Other questions?
You can only change yourself.
7-day cruise helps to change
Tom Taylor?
with the
Oh, you're going to the bathroom.
reprogram.
In
case everybody wants to know.
I'm wondering what the harm is in the vegetarian diet, one can eat eggs and dairy. What is the harm in dairy and eggs?
China's
Okay, resume the China study.
I just want to say something on that. On the cruise, we had a whole hour-and-a-half presentation on just dairy. Because the doctor was saying, there's just so many people who say, hey, we're vegetarian, so it's okay with the cheese. And he showed us the incredible marketing that was done and how the cheese consumption has rocketed like this. And then the effect on health.
Also, back to forks over knives, the study that Dr. Campbell did showed that as dairy made progress into different regions of China, he essentially, those of you who haven't seen it, he did an exhaustive study based on the request of the president of that time of China, Zhou Enlai, because Zhou Enlai had cancer. He wanted to know what's going on here. So he employed 500,000 Chinese researchers to look at all of China and where the penetration of Western diet, more meat, more sweets, more dairy. Dairy is now expanding in India, of all places, organized dairy. And as they found more dairy, more cancer. Here's another story. When the Germans took over Holland, they stopped production of meat going to the local people, and they brought it into the German army for the nourishment of their own soldiers. Guess what? Heart conditions dropped like a stone in Holland among the people that were not eating meat, but the cancer rate returned after World War II and they started going back to eating meat. I'm not advocating for everybody that a meat-free diet is the only way to go, because I think we're a very diverse couple. It has worked for me and from all of the research I've seen. Alzheimer's, 200 pills have been prescribed for Alzheimer's, and not a single case of anything working at all. And here's this article in Scientific America suggesting that diet, exercise, and social interaction is the key to staying well as we get older. Yes, can you come up to, oh, hi, Fran.
First, I want to say thank you to Tim and Regine for doing this and all that it took to
And
pull
Sally.
this together. And Sally. And I liked Sue's comment about John Ness gets questions and people say, I can't do this, I can't do this. And because our society is so different from the type of eating that Tim and Regine are talking about, we need information. And Tim and Regine coming here today has been excellent for giving us that information and inspiration. They're so fit themselves, and they eat so well, and they inspire us. But I think, Sue, that what people are saying to John is, I can't do it all. And we're a society that thinks we have to do it all. Tim and Regine invested the money and the time to go on this cruise. And then they brought back to us a lot of knowledge that can help us. Not all of us are going to do what they did, but we can benefit from what they did. Information, this is my favorite book,
Yeah.
Veganomicon. Sally knows it. She knows one of the authors. And if you want to buy yourself an excellent Christmas present, that's an excellent Christmas present to learn about vegan cooking. But again, thanks, Tim.
Sure, you're welcome. I also would like to plug some of the authors that we saw on the cruise. There's one particularly, Michael Greger. Any of you that aren't familiar with Michael Greger, Google him and become a regular follower. He sends out these incredible, he's written a book called How Not to Die. And it sounds pretentious, but I also have in this room 2 or 3 friends of mine, very close, lifelong friends. I've known Tom's gone, that are cancer survivors. And they've had a teaching moment when they got cancer. And not to say that they advocate a vegan diet or anything else, but this is when John finally gets their attention, not these individuals, but
This is
friends of
dropped on the
ours.
floor, you might want to mention this.
Someone lost a bracelet. But nonetheless, that's the kind of teaching moment we need often to get the attention of people. Anybody knows of any school that I could give my presentation to in Tallahassee, let me know. I'd be happy to do that too. Question, Fran?
On the way out, there's a bucket of fresh picked Tangelos, and everybody help yourself as you go out. That's another piece of
And Mark,
yellow bucket.
thank you. Yellow bucket out there. And Mark just went by. He writes an excellent article for the Tallahassee Democrat on nutrition every Tuesday, so stay tuned to that. And join Sally and Regina and I in the Vegan Tallahassee Society of Tallahassee. Also, we'd love to have you join. Thank you very much. Ed. Wait, one more question. Ed sat in a class with me at, we went through the epigenetics class together. He's a biologist.
Hi, how you doing? This isn't really a question. I just want to thank you. It's very enjoyable. But I want to mention that December 31st, Sunday, Sally Sanders is going to be at our church presenting the homily on food choices.
Oh, nice.
What it means to us, our environment, and the web of life. So you're all invited to come to that too as well. So it's 11 o'clock in the morning.
Which church?
Unitarian Universalist Church, 2810 North Meridian Road.
I'll send an email to everyone too.
Great, cool.
And thank you, Sally, for the invitation, and thank you, Maggie and Charlie, for opening your...
Say again, tell me when.
I will say also, this is the finest
It's
establishment.
December 31st,
Live music.
11 a.m.
And you saw one of the folks serving, and Mary Cox is one of the fine performers.
at 2810 North Meridian. That's the address.
Thanks for coming.
10 North Meridian.
Too busy.
Nice talk.
Appreciate it.
Very good, okay.
The next frontier is their
I know what's going on.
No, you're not going to make
Well,